The objective of this module is to provide you with tips on how to deliver a presentation in a way that connects with your audience. We will be looking at ways to communicate key messages, as well as approaches to bonding with your listeners. We will start with a well-used maxim that we all know. Tell them what you're going to tell them, and tell them what you've told them. This is based on Aristotle's ideas about giving speeches and is extremely helpful in the area of education and instruction. It's also a good place to start when thinking about audience engagement. First, let's clarify the difference between education and public speaking. Public speaking also involves engaging your audience. However, this is done somewhat differently from the approach that is used for education and instruction. Public speaking utilizes modes of message delivery such as storytelling and anecdotes. However, our objective as teachers, lecturers, and faculty members is to communicate concepts, instruct, and teach. You can tell interesting stories about your experience as a cardiologist, but if you're instructing an audience about the proper operation of medical equipment, this tell 'em approach works best to ensure the learner leaves with the necessary knowledge and competencies. We are going to look at these 3 steps in detail and provide you with some tips to help connect with your audience and get your points across. Step 1. Tell them what you're going to tell them is the step that prepares the listener to hear you and lets them know what information is going to be provided. Consider communicating why you are speaking to your audience, what the learning objectives are, and preferably provide an agenda or content slide. You will be most effective in this step if you consider not only what you want to say, but also what the audience needs to hear. You need to provide a certain amount of direction and leadership at this stage and tell the audience why they are there. As an example, here are the learning objectives for this presentation. These indicate what behaviors this module is trying to teach. The opening commentary to the first few slides should have also given you an indication of what we are going to focus on and why it is important to an emerging member of faculty. The content and structure of this session is shown in the list here. Note that you do not always need to use slides to communicate this information. In the video clip that follows this slide, you will see an expert educator, Dr. Rick Nishimura, give a verbal example of one way to tell them what you're going to tell them by describing how the presentation will be run. Listen to Dr. Nishimura communicate these 4 points. That his session will help the audience to secure MOC Part 2 credits. The program's content will be presented in the context of the upcoming new guidelines on valvular heart disease. The session will be structured around questions and answers, and the thought process behind the answers will be explained. Finally, Dr. Nishimura encourages the audience to participate.
So as Pat said in the very start, what we're trying to do at the college is to facilitate the methodology by which you are able to obtain your MOC credit. And this is kind of a fun session because the questions we wrote with kind of a clinical decision-making background, knowing that the new valve guidelines will be out in the next month or so. And so what this will do is kind of keep us all updated, not only on new information that's come out about valvular heart disease, but also kind of the clinical decision-making process that we use to be able to take care of our patients. Now, we've always said there's no right or wrong answer, so we're not going to argue about whether an answer is right or wrong, but what we want to do is take you through the thought process by which we arrive at these. And we also want comments from the audience, so if the audience has anything to say, you can either get up, run to the microphone, or raise your hand because we'll have time to get some audience participation too.
Now that the audience is prepared for what is to come, this is the time when you present your content and explain the details of what you are trying to teach. Do this as simply as possible and follow the guidance laid out in the following tips. Here are 5 tips to assure that you are addressing Step 2. Tell them. The next slides will cover pointers for each of the tips you see listed on your screen. First, define exactly what you want your audience to know or be able to do by the end of the lesson. This will focus your preparation. Second, consider using a guide to producing good slide sets, such as the ACC modules, Maximizing the Power of PowerPoint, and Barista. You may also want to develop supporting handouts. These serve a number of purposes, including allowing the listener to focus exclusively on what you are saying rather than trying to take notes at the same time. Different people learn in different ways. Some learn best by doing. some by seeing, some by listening, and some by reading. If you provide handouts and use visual aids, you'll reach and engage more of your audience. Another important part of preparation is rehearsing. Rehearse your presentation out loud, accompanied by the slide set. If possible, get someone to listen while you rehearse and ask your listener for honest feedback about your presentation skills. Preparation also includes making a backup plan. What if your projector dies, or the computer crashes, or the memory stick doesn't work? In some cases, you may have no choice but to go with an AV-free presentation, so have a printed copy of your notes with you. Emailing yourself a copy of your presentation may help if you lose your memory stick. Finally, if you are able to, familiarize yourself with the room in which you will be presenting. See how the chairs are arranged, whether there are any blind spots, and if there are microphones available for audience questions. Building rapport with your audience engages them in the subject of your presentation. Rapport is something that is so basic to quality communication that we tend to overlook it sometimes. And how do you build rapport? How do you maintain it? And if rapport is lost, which will sometimes happen, how do you get it back? The solution often lies in using a mixture of the following: appearance, building trust, body language and positioning, and language and humor. Ensure that you dress to convey professionalism. The audience needs to see you as the expert. However, do pay attention to the location of the presentation and do not alienate your audience by dressing very differently from them. The video clip that you watched showed Dr. Nishimura presenting at an educational course, which has a casual dress code appropriate for the ski resort where the course is located. He is dressed very appropriately for that environment. Several publications and websites contain information on the use of language and humor when giving a presentation. Recommendations include being inclusive when you speak, avoiding jargon, using vocal emphasis such as volume, pacing and tone, resisting the urge to read a script, and instead utilizing natural speech patterns. All these build rapport with an audience and minimize alienation of the listener. Humor can also engage your audience and may be used to reinforce the points you want to make. You can find guidance on using humor in ACC's module, Humor Your Audience. In the next slide, expert educator Dr. Patrick O'Gara demonstrates a nice way to use humor to communicate a message to an audience, in this case, that he was discussing an asymptomatic patient.
So let's go to question 6, which is a 52-year-old fellow with a heart murmur. He's completely asymptomatic. He's not only asymptomatic, he's completely asymptomatic. It's like getting on a plane and they'll say that this is an extremely full flight as compared to a full flight. Have you been on a full flight? And do you know the difference between extremely full and full? Anyway.
You can amplify your teaching points not only with words, but with your body. We do this in everyday communication without even noticing. Think about nodding or shaking your head, moving closer to or away from somebody, pointing a finger. Eye contact is also an important part of body language, as is walking around during your presentation, so that the whole audience feels included in what you have to say. Come out from behind the podium, which only serves as a barrier between you and the listener. Use body language to highlight or illustrate points, and most important, be natural. In the next video clip, Dr. Nishimura provides an excellent example of a speaker communicating that he is comfortable, confident, and relaxed through his body language. By moving around the stage, he is creating visual variety, speaking to the whole room, and encouraging the audience to focus on what he has to say. He also urges the audience to be attentive by using hand movements to emphasize important points.
A workup showed no evidence of active myocardial ischemia on a PET scan, but his echo did show moderately severe mitral regurgitation due to a left ventricular remodeling and papillary muscle displacement. So there's leaflet tethering and the jet went posterolateral, and the regurgitant orifice area was 0.3 centimeters squared. Okay, so that's moderately severe mitral regurgitation. He now, after the hospitalization, is able to do his daily activities. On examination, his venous pressure is normal, his lungs are clear, there's a 2/6 holosystolic apical murmur, but he had heart failure. So what is the next best step in his management? Continue the GDMT, perform left and right heart catheterization, get a better idea on his filling pressures and his pulmonary pressure, refer him for mitral valve repair or replacement, refer him for percutaneous mitral valve repair. Go ahead and punch in your answer.
Now let's move on to building trust. Once you have successfully built rapport, you will have established a level of trust with your audience, which is an important part of the audience engaging with you and, ultimately, retaining the information that you are giving them. Other pointers include focusing your energy on being positive, open, and speaking with conviction. Demonstrate in your opening statements that you know who you are talking to. Finally, share your personal experience, which will level the playing field between you and your audience and help to build trust and rapport. In a previous video, Dr. Nishimura demonstrated one way of encouraging audience interaction when he invited questions from the audience. If you prefer, or if listeners aren't asking you questions, then ask them questions. In either case, don't forget that this is the step when you tell them the main message of your presentation. So use each question and answer as a teaching moment. Encourage listeners to feel that their questions are welcome and make them feel respected when they ask or answer questions. When you ask for questions, be sure to allow some wait time so learners can formulate their questions. Then repeat the question before you respond with an answer so that all learners have context. If you find yourself fending off challenges instead of questions, ensure that you clearly state the facts. Provide references as appropriate, and use confident body language, such as walking toward the challenger. Above all, remember it is important to have active audience involvement. It holds their attention and ensures engagement.
Oh, very, very good point. So the ejection fraction, as you know, with mitral regurgitation is going to be higher with the same ventricle than without mitral regurgitation. So anytime the ejection fraction falls below 60%, or the end systolic dimension is greater than 40 millimeter, because that's a nice thing of contractility, that's left ventricular dysfunction. So that means that those are patients that I would insist on operating on. Less than 60%, greater than 40 millimeter. Very, very good point.
Now let's look at ways you can highlight the key points of your presentation and help your audience to remember them. The first is to number your points. The second is to chunk your material into sections. How do you eat an elephant? One bite at a time. Chunking teaching material into sections allows you to deliver individual messages and prevents the audience from being overwhelmed. As identified in the last slide, asking questions of the audience allows you to highlight and them to remember the important elements of your content. If you are in a small group setting, you might clarify teaching points by encouraging discussion on important elements of the material. Finally, the use of repetition is a helpful way to highlight key points. Next is a video of Dr. Nishimura's approach to highlighting key learning points.
But in this patient here, if you take a look, and we did this in the cath lab, we started out with a mean gradient of 17 to 20 millimeter of mercury. With dobutamine, you normalized the cardiac output, and the gradient went to over 40 millimeter of mercury. So this patient truly has severe aortic stenosis and would benefit from aortic valve replacement, whether or not you might want to do a surgical AVR, or in this case, a TAVR was done. I think it's very reasonable, but this patient is at high risk. But certainly, when you see something like that, you know, number one, they have contractile reserve, so that stroke volumes increase by more than 20%. And number two, they'll probably benefit because this is indeed severe aortic stenosis. Any questions about this?
Remember that although the three-step tell them process is a formula, it should not be formulaic. You can follow the three-step process, but don't be mechanical in your delivery. Be natural and let your personality shine through. Stand up front where your audience can see and hear you. Presenters sometimes face the screen, watching their presentation rather than their audience. Instead, turn to your audience and make eye contact with them. It is easier for them to hear what you are saying, and they will find your presentation much more interesting. Finally, don't rush through your slides. Pace yourself so that the audience has a chance to digest what you are saying. Step 3 is tell them what you told them. In a clinical lecture, the most common opportunity to review and summarize or reiterate previous points that you have made is to leverage questions from the audience. For example, lead them to the appropriate answer by reviewing what you told the audience earlier in the presentation. Say, think about those differential diagnoses I covered in the last slide. Alternatively, summarize the content. Say, let's review the treatment options we've been covering today. Another approach to reviewing material is to invite your audience, either during question and answer or at the end of the presentation, to tell you what you just told them. The military calls this the brief back. It is an instant audit on your message and will indicate whether you communicated clearly and concisely or if you still have some more work to do. In some settings, it may be appropriate to ask the audience to do something at the end of a presentation, such as committing to sharing the new knowledge with someone else. However you decide to close, do so on a positive note, even when your message is a difficult one. Finally, depending on the context, it may be appropriate to ask audience members to complete an evaluation, which will help you to assess how the presentation went from the point of view of individual listeners. On the next slide, look at a video of Dr. O'Gara using the technique of questioning the audience to check their understanding and to emphasize teaching points.
So we'll go back to the STEM, if we can. Here she is. So what does the STEM tell us? What does she have by history and physical examination, do you think? What were you thinking as you read through the STEM? She has symptoms, right? She has symptoms, and you think she has mitral stenosis. And on the basis of the examination findings, how much mitral stenosis do you think she had when you read through this? It's not a trick question. What was your initial reaction? You thought she had significant mitral stenosis, and with pulmonary hypertension, okay? So then what did the echo say? It didn't say that, did it? So here we are in another situation where your clinical intuition is telling you one thing and the non-invasive information is telling you something else.
This module has provided you with a number of pointers and tools to help you to engage your audience using the 3-step Tell Them process. You have also seen 2 exceptional educators apply some of these techniques in a live teaching situation. Now armed with their practical example, the 3-step process, and the tips contained in this module, you will be able to structure, produce, and deliver an effective presentation which engages your audience. Good luck!